Hey everyone, welcome back to Medical Coding Club. This is Chandrika. So today I'm going to discuss most repeated CPT and ICD coding guidelines for your CPC exam, and these questions are collected by the students who wrote exam in 2024. So as you all know, for CPC examination you will be getting 7 marks from coding guideline. Okay, so that you should know the coding guidelines thoroughly. So I have added some question and have explained also, so please do watch and understand, and please do use this video as for your additional reference. After your regular AAPC practice, you can come back and you can check these additional questions. Okay, so let's begin. So the first question we have, it is a CPT coding guidelines from integumentary section. So as you all know, we have three type of repair: simple repair, intermediate repair, and complex repair. So coming to simple repair, here we will not have any extensive contamination, or will not have any foreign body. And coming to intermediate repair, here it will be like little significant involvement will be there, and contamination with foreign body will be there. Okay, and complex, it is reconstructive procedure. So in this question they are questioning about, according to the repair CPT guideline, what type of report is reported when single layer closure includes with irrigation and extensive cleansing. So it is easy. The answer should be intermediate repair, because intermediate repair or the layered repair need extensive cleansing. Okay, so the correct answer will be intermediate repair. Next question, which statement regarding lesion excision is true? Again, this is from integumentary section and regarding excision concept. So you should know excision plus simple repair. You cannot code simple repair separately, because simple repair is an integral component of excision, whereas excision plus intermediate repair or complex repair, we should code it separately. Okay, so this guideline you should know. So coming to this question, if you see the option, they are just questioning lesion excision code include removal of lesion with margins. Okay, so when we are coding for excision of lesion, please remember it always includes the lesion centimeter and the margin. Okay, so we will be like, it will be like we will measure both margin and the lesion centimeter, and then we are going to assign the code. So by seeing the option here, option A is correct. Lesion excision code include removal of lesion with margin and simple closure when performed. Okay, so excision plus simple repair, we don't code simple repair separately. Simple repair will be a component of excision. Okay, so yes. And next, which of the following is an example where diabetes is a related problem exists and code for diabetes is never sequenced first? So if you refer this ICD coding guideline, so in which cases we will not assign diabetes as a primary code? So the answer must be, if the patient has an underdose of insulin due to insulin malfunction, then we will be assigning this malfunction code first, followed by diabetes code. Okay, so answer B will be correct. So next question, here they are questioning about description of CPT. I'm not sure what is the full question, but usually this kind of question, like description question, they'll ask just to verify that do you have that knowledge based on how to take the code from standalone and intended code. So here if you refer, they are questioning 69644. I have added an image, please check here. So here 69641 up to semicolon, you can, the description you can carry forward. Okay, so 69442 is like a chain reconstruction, 43 is without a chain reconstruction, and coming to 69644, here it is with intact or reconstructed canal wall and with chain instruction. Okay, so you don't have to these two are only regarding the reconstruction procedure, whereas 69643 and 44 are with intact. Okay, with intact. So 69644 should be, we've added the answer. You have to take 69641 up to here, and then you have to add this description. Okay, so then overall description is this one. Okay, so from semicolon you have to add the other code description. Okay, so next coming to one more CPT coding guideline. Here what is the which concept it is? It is chemodenervation. Okay, chemodenervation concept. So here they are questioning a patient with idiopathic dystonia receives botulinum injection, 3 muscle injections for both upper extremities and 7 injection in 6 paraspinal muscle. So as soon as you see paraspinal muscle, you should understand that belongs to trunk region. Okay, and coming back to extremity coding guideline, what extremity coding guideline do we have? So for chemodenervation, if you check this image, I've added an image. So we have two code category. Okay, 1 to 4 muscle, one set of codes we have, and 5 or more muscle, one more set of code we have. Like one will have primary code and one more corresponding add-on code for additional extremity. So what we have to check here? So in this question, they are saying both upper extremities, and you should check the muscle. So 3 muscle injection in both upper extremity, 3 muscle, then it comes in a category, first code category, that is 1 to 4 muscle. Okay, this 1 to 4 muscle category, it will come. Since they have given both extremity, you will be assigning one primary code and corresponding add-on code to report the additional extremity. And again 7 injection in 6 paraspinal muscle. So again they have given 7 injection to trunk area. So I've added an image. 64647 is chemodenervation of trunk muscle, which is 6 or more. Again it will be a primary code. Okay, say for example in this case, as they said both upper extremity, in one extremity they have given 4 muscle injection, and one more extremity if they have given 5 or more muscle like injections, then we should assign only one primary code which is having the highest muscle. Okay, so we will be assigning in the, like for example, one extremity they have injected 5 muscle, so that I will be assigning 64644, and with that, if one more extremity, if they have just administered 3 muscle, I should go and take the add-on code from 1 to 4 muscle code category. Okay, so this is the coding guideline, and the answer will be B, 64642, the extremity code, add-on code, and this is for the trunk region. I hope everyone understood this. So next, coming to one more CPT coding guideline, which is regarding fracture. Again here I'm not sure what is the question is, the question is regarding the initial fracture care or follow-up. Like I am not able to get the question completely. So here I am just going with the two questions. Okay, so if they are questioning about initial fracture care, okay, with initial fracture care, if they are billing, splinting and casting, we will be just assigning code for fracture care. Okay, but if patient is coming back for a follow-up care, and in follow-up the patient is taking splinting or casting, then we have to assign the casting code. Okay, whatever the thing that they, so according to this question, the application of cast and strapping CPT coding guideline, what reported when an orthopedic provider performs an initial fracture care for a closed fracture of the wrist and now applies the short arm cast as patient returned for follow-up care. So in this question they are asking in the context of follow-up care. So now patient is for follow-up. So and the provider has applied short arm cast. So I am going with 29075. Okay, so if the question was about initial fracture care, then we would have gone with the 65622. Okay, fracture. So read this guideline, you will understand. So when casting call for separate coding, all fracture codes include the application removal of initial cast when provider treats the fracture and then place the cast. and report only CPT code for fracture care. Okay, so this is regarding initial fracture care visit. Next, the application of cast is inherited to the fracture treatment procedure code. However, the provider subsequently applies or replaces the cast during follow-up encounter, then report the procedure code for casting. So I am taking this question as a follow-up and I am assigning the code for casting. Okay, to 9075. So whatever the question may come regarding the fracture care guideline, refer this guideline and understand and give the appropriate CPT code. So next, coming to ICD coding guideline. Here the patient is diagnosed with a diabetic polyneuropathy. Using ICD-10 CM coding guideline, what ICD code is reported? So we all know here there is a combination code diabetic with polyneuropathy. So that is answer will be E11.42. Okay, so you should, if you are not at all aware how to code for combination code, please refer the ICD conventions or ICD coding, general coding guideline regarding combination code. Okay, so the combination code is a single code used to classify two diagnoses. Diabetes itself a diagnosis, and again polyneuropathy is also on one more condition. So together we are billing. So that is called combination code. E11.42 will be the correct answer. So next, coming to one more ICD coding guideline. So here this question many students have asked me and they have argued with me that the answer is I20.0 because which is myocardial infraction. So here read the question. An elderly patient comes to an ED with a shortness of breath. An ECG is performed. The final diagnosis at discharge is impending myocardial infraction. Okay, again this question I'm not sure whether it is complete or not. I'm just helping you with the guideline. Okay, what guideline do we have? ICD-10 guideline for impending. So many of you will not be aware. Since they are mentioning impending myocardial infraction, we have certain guidelines. Okay, so I've added an image. Please check it. So whenever we are coding for impending or threatened conditions, okay, so it should occur. Okay, if you are going to consider it as a final diagnosis as they have described it in discharge summary, it should occur. That means they should mention like myocard patient got infraction. Okay, here in this case they are diagnosed. Okay, so if it did occur, code as confirmed diagnosis. If it did not occur, then refer the alphabetic index to determine the condition of subentry of impending. Okay, so here in this question, myocardial infraction what is this? Myocardial infraction was not occurred. They have just diagnosed. Okay, so that we have to go to the second coding guideline we have to follow. And if you follow this coding guideline, we will not have any subterm listed under impending. Okay, so what we can do, this is the last guideline. If subterms are not listed, code the existing underlying conditions and not the condition described as impending or threatened. Okay, so here we have to go with the underlying cause, that means symptoms, like whatever the thing that they have documented. So they have documented shortness of breath. According to ICD coding guideline regarding impending, we should go with the R0602. Okay, so in your exam, if you get this question, refer it completely, and if somewhere if they are documenting that myocardial infraction was occur, okay, then you can go with I20.0. Okay, that unstable angina will come, so you can choose I20.0. If this is a question, then you should go with shortness of breath only. Okay, so next, coming to one more ICD question. So here patient had a polyps removed on a previous colonoscopy and patient returns 3 months later for follow-up examination for another colonoscopy. No new polyps are seen. What diagnosis coding is reported for the second colonoscopy? So here they are only questioning about uh, history, and also now again they came for screening, so that it is easy. We will be assigning Z09, the code used when patient undergoing follow-up examination after treatment for the condition having resolved. So now it is like an encounter, and the screening returning follow-up examination where no new polyps are found. Therefore, the encounter specifically for follow-up which coded with G09. And again they are saying they had colon polyps. They had colon polyps, so we can assign the history of colon polyps. Okay, so answer should be A. And then last question. A patient is diagnosed with a sepsis and associated acute respiratory failure. So what is the ICD-10 code selection is reported? So here many of the students have argued with me that option C is correct. Okay. So according to ICD guideline, and the answer should be option A. Okay, I'll tell you why. So you may just think like in the question they are not talking about severe sepsis, or there is no documentation about severe sepsis, so you think like we don't have to code for severe sepsis. But when you actually refer the ICD-10 coding guidelines, see here, so they are saying the code from subcategory R65.2, which is severe sepsis, should not be assigned unless severe sepsis or an associated acute organ dysfunction is documented. Okay, so either severe sepsis should be documented or else associated acute organ dysfunction is documented. So in our question, the organ dysfunction is documented. So it means we have to code for severe sepsis also. So correct coding will be sepsis, severe sepsis, and followed by organ dysfunction. Okay, which is acute respiratory failure. Okay, so option A is correct. And if you still have doubt, please ask someone your mentors or someone, and you should also get it clarified. If I am wrong, I can maybe. Okay, so these are the important and repeated CPT coding guidelines for 2024 CPC exam. Do not ignore, refer all of the question and answers. Okay, and so thank you for watching, and please do subscribe to my YouTube channel and share with your medical coding friends. And if you're any of your friend preparing for CPC exam, this video will definitely help them. Many will just get fail in 1 or 2 marks. So that should not happen. So refer the coding guidelines. Do not stick to only 10 of these questions. In the same way how they are framed, in the same way just refer all of the ICD and CPT coding guideline. It will be easy. Okay, and yes, thank you for watching. And again, if anyone looking for CPC preparation classes, I do conduct classes. Please do text me on WhatsApp with your name and get the course details. Okay, yes.